So one of the questions that I'm commonly asked by patients looking at hip and knee replacement surgery is, what is the risk of infection? If infection occurs with hip and knee replacement surgery, it can be a devastating complication, potentially requiring multiple other surgical procedures. And so this is an understandable concern for patients. If you look in the literature, the most common risk of infection rate quoted is around 1%. I think this really varies surgeon to surgeon and location to location. Patient factors also play a role. Patient health, medical status play a role. So maintaining good health, good diet, all reduces the risk of infection. From the surgeon standpoint, the things that we can do to help is to maintain strict sterility, to move relatively quickly through the surgery so we have the patient undergoing surgery in an expeditious time frame instead of having the surgery drag on for an extended period of time. Also the location. It's been shown in multiple studies that centers that do high volumes of hip and knee replacement are better at doing this procedure. Their sterile techniques are better, their infection rates are lower. I'm happy to report here in my practice, our infection rate is significantly lower than 1%, typically around 0.1%, which I'm very happy and proud of. But this is a very legitimate question and something that patients should ask their surgeon about.